Hello everyone, welcome back. So moving on towards the next part in the series of diseases of dental pulp, so that will be internal resorption. Now resorption, it is classified into two types, that is external and internal. So internal resorption is the one in which the process it is occurring within the pulp, and as we are seeing about the diseases of the pulp, so we are going to see about internal resorption in this video, and later on in some other videos we are going to see about the external resorption. So starting with the definition of resorption or internal resorption. So resorption in general, it is defined as a condition which is associated with either a physiologic or a pathologic process. So physiologic is whenever the tooth is forming. So that time only something happened with the cell with the formation, and because of that resorption occurred. Or it can be pathologic process. So pathologic can be because of some inflammation, that is periapical inflammation, tumors, cysts, if there is some dental trauma which has occurred. So all this can also result to resorption. So what happens is it results in the loss of dentine, cementum or bone. So this is the definition of resorption which is given by American Association of Endodontists. The internal resorption, it is defined as the idiopathic process. So idiopathic is when the cause is unknown. So it is an idiopathic, slow or fast progressive resorptive process. So resorption is whenever there is this resorptive process. So this can happen slowly or fastly. So it is the process which is occurring in the dentine of the pulp chamber over here. So dentine of the pulp chamber or in the root canal of the teeth. So that is nothing but internal resorption. So we have earlier seen that internal resorption, it is a process which is occurring within the root canal space, and hence it is the internal resorption. Now, what is the etiology behind internal resorption? So, the cause of internal resorption is usually unknown, but most of the patient they will have the history of dental trauma. The other etiological factors can be periapical inflammation, tumors, cyst, or if there is an impacted tooth, or if the patient is having excessive occlusal forces. So all of this can also lead to internal resorption. Now this internal resorption, it is also classified into two types, that is inflammatory or replacemental. So inflammatory, as the name says, it has something to be done with inflammation, and replacemental will be, so instead of dentine, bone is formed. So instead of dentine, so dentine it is replaced by bone. So that is the meaning of replacemental internal resorption. So now we are going to see about the etiopathogenesis of the inflammatory internal resorption. So there's this pulpal inflammation which has occurred due to some infection, that can be dental caries for example. So inflammation has occurred. So because of this inflammation, what has happened is there is the alteration or the loss of peridentin and the odontoblastic layer. Now in this picture you can see over here there is this dentine, pulp, and between this dentine and pulp there is this peridentin and the odontoblastic layer. Now it is said that the mineralized tissue of the teeth, they are protected in the pulp cavity by these two layers, that is your predentine and the odontoblastic layer. So if these layers are only damaged, or if they are altered, or if they are lost, so because of that what happens is the osteoclastic cells, they will go and it will colonize the root surface, and because of that the resorption will occur. So this two layers, they play a very important role in the protection of the mineralized tissue of your teeth. So now in this what happens is, so the pulpal inflammation, it leads to this damage of these cells or this layer. So because of that, the undifferentiated mesenchymal cells which are present in the pulp, it will come in contact with the mineralized dentine. So there are some cells which are present. So the composition of pulp, you'll see that there are this undifferentiated mesenchymal cells which will differentiate later on into some other cells, that will be bone, cementum or dentine. So what happens is, so now this layer, it is damaged. So those cells, it will go and it will come in contact with the mineralized dentine, and they will differentiate into dentinoclast. So dentinoclast is the one which is leading to the resorption. So because of that resorption, it results. So now in this inflammation, it will lead to the alteration of this layer. Because of that, the cells, undifferentiated cells, it will differentiate into dentinoclast, and because of that there is resorption which is occurring. Now, what are the symptoms of internal resorption? So, internal resorption usually it is asymptomatic except if there is perforation of the root. So in that case, the patient will complain of pain. So perforation of root, so perforation basically is nothing but whenever you have the communication of the periodontium with the root canal space. So if the communication has occurred, so in that case the patient will complain of pain. Now the next main important thing about this internal resorption is the crown of the tooth. It will manifested as a reddish area that is nothing but a pink spot, and because of this only internal resorption is known as pink tooth of Mummery. So pink tooth is why, because you see this pinkish discoloration, and Mummery is behind the, so after the person who have named it, that is James Mummery. So it is known as the pink tooth of Mummery. Again, a very important question like in vivas or MCQs. Now, why do you see this reddish or pinkish discoloration or this pink spot? Now, this is why, because the area of the dentine, so instead of dentine, that area it is covered by the granulation tissue, and which is shown by the resorbed area, which is shown through that resorbed area of the crown. So what happens in this resorption is, so your dentine it gets resorbed. So now internally, so this resorption it is replaced, so that dentine it is replaced by this granulation tissue. Now what is your granulation tissue? It is nothing but a vascularized tissue, and you see this granulation tissue whenever there is some injury which is occurring. So it is like a repair, so it is like the body's attempt to repair. So now in this, the body it was trying to repair it, so instead of dentine, your granulation tissue is covering that area, and because of that only you see this pink spot. Now, how are you going to diagnose the internal resorption? So clinically, main important thing is you'll see that pink tooth appearance. Radiographically, you'll see there is this radiolucent enlargement of the pulp chamber, and the bone, so your outline of the root canal, it will be distorted. And the next important thing in the diagnosis radiographically will be, you will see the bone changes whenever the root perforation is present. So whenever your root is perforated, so in that case there will be communication with the periodontium. So in that case you will see some bone changes radiographically. Now whenever you do the pulp test, so it will come as positive. Why? Because over here, so you'll see that the coronal pulp is necrotic but the apical pulp is vital. So in such cases you will see the pulpal test is positive. And if your vital pulp is also, if your apical pulp is also involved in case of perforation for example, so in that case the pulpal test will be negative. Now what are you going to see histopathologically? So histopathologically you'll see that it is a result of osteoclastic activity. Now resorption, that means osteoclastic activity has occurred. So whenever you have this suffix as class, so that means it has to be done with something like resorption, and if it is blastic activity, that means it is to be done with the deposition or formation of that particular thing. So now the resorption has occurred, that means it is a result of the osteoclastic activity. The next thing that you'll see histopathologically will be, it is characterized by lacunae that may be filled by the osteoid tissue. Now what is this osteoid tissue? So osteoid tissue, it is the portion which is formed prior to the maturation of the bone. So what happens is osteoblast, it begins the process of formation of the bone by the secretion of this osteoid tissue. So the first thing that you will see whenever there is formation of the bone will be the osteoid tissue. Now this osteoid tissue, it is regarded as the attempt at repair. So what happens is whenever body sees some injury, so they try to repair it. So in this also they have seen that there is this osteoclastic activity which is happening. So because of that, body it lays down the osteoblastic activity in which it will try to repair it by the formation of the bone. So in this thing only you will see that there is the formation of this or a lacunae which is filled by that osteoid tissue. As I said, osteoid is nothing but the first portion that is laid down by the osteoblastic cells. The next thing will be the presence of granulation tissue, again an attempt to repair. So you will see granulation tissue. Now we have seen earlier that the dentine, it is replaced by the granulation tissue, and the treatment for this internal resorption is the removal of the pulp. So whenever you're removing the pulp, now as the dentine, it is replaced by the granulation tissue, and granulation tissue, it contains too many of blood vessels, capillaries. So whenever you're trying to remove this pulp, there will be profuse bleeding that you'll see. The next thing is there will be multinucleated giant cells or dentinoclasts which are present. Then the pulp is chronically inflamed, and the next thing will be there will be metaplasia of the pulp. So this thing, it will be seen in the replacemental type of internal resorption. That means the transformation to another type of tissue such as bone. So the dentine, it is transformed or it is replaced into bone or cementum. So this thing, it is seen in the, so the metaplasia of the pulp is seen in the replacemental type of internal resorption. The treatment, as I said, it will be root canal treatment. So root canal treatment, it will stop. So extirpation of the pulp, it will stop the internal resorptive process. So whatever happens is happening in the pulp. So if you remove that pulp, so automatically your internal resorptive process, it will stop. Now in this, what we do is, instead of the normal like gutta percha technique, so normal obturation, what we do is we used a plasticide gutta percha method because of this radiolucent, huge radiolucent area which is present. So whenever you remove that area, so there is this huge area which is formed. So you need to replace it properly, and lateral compaction and everything. So the normal techniques, it won't help in such things. In the internal resorptions, in that case, you need to go for this plasticide gutta percha method. And if the root is perforated, so you need to create that barrier. So you will create that barrier with the help of MTA, that is mineral trioxide aggregate, is recommended to repair that defect. And if the crown and the root is perforated, both are perforated, so in that you need to go for surgical repair. So these are like the treatment modalities for the internal resorption. So that was all about internal resorption, a very commonly asked question in your exams and viva. I hope you found this video helpful. Thank you so much.